Our daily COVID-19 briefing. Today we're proud to do it here in Shelby County. We just had a meeting with Mayor Strickland and representatives from Mayor Harris's office, Dr. Haushalter, Representative White, and other leaders from around the community to talk about this COVID-19 issue in our state, and specifically here in Shelby County, and how it is that the state and the county and the city and the officials and leaders can work together to address this crisis that we face. I want to just say a few words to Tennesseans that I say every time I get before a group, and that is, we're going to get through this crisis, but we will only do so because of Tennesseans taking personal, individual responsibility for taking care of not only themselves, but their neighbors. This is something that Tennesseans can do, but we're going to have to do it together. And we're going to have to be serious about what it means to socially distance and what it means to use good hygiene and stay away from crowds and groups, and stay away from church gatherings that are too close or work gatherings that put us in proximity with one another. This is a very serious issue that will profoundly affect the health and, in some cases, the lives of Tennesseans. We have already lost Tennesseans to this virus, and we will lose more, but to the degree that Tennesseans, and today I'm speaking to West Tennesseans in particular, to the degree that you can do your part to stay apart, to the degree that you can engage in your community and help your neighbors. I want to commend not only the individual efforts of folks, but corporate efforts like FedEx, who has done a significant amount of work to transport supplies across the country and in our state. We're grateful for those partners. It's been encouraging to see private sector partners step up. Grateful to see the cooperation of our private sector healthcare companies, hospitals in this region, healthcare providers in this region who have done a couple of things. One, brought up remote testing facilities. By the way, today a remote testing assessment site on Tiger Lane, it opened for business today. Increased testing is incredibly important. The public availing themselves to testing when they qualify is incredibly important. The more testing we do, and the testing resources have been strained, but they are improving daily. The more we do that, the more likely we will blunt the curve and provide for our healthcare system to accommodate the coming surge of COVID-19 that's coming to our community for certain. There are a lot of the efforts that we talked about today were the structure that we put in place at the state. We have formed something called a Unified Command Group. It is a combination of Department of Health, Department of Military, TEMA, working together around the table and working in conjunction with local communities, just like in Shelby County. That Unified Command Group is here with me today, and you'll hear from a couple of members of them in a few minutes. But we were meeting with officials here to make sure that there is a connected stream of communication between Shelby County and the state, that we are sharing information, being transparent, so that we can all work on this together. I do want to say that we're making tremendous strides in the procurement of personal equipment, in the expansion of bed capacity in the future, in the steps for testing and for assessment. We are making great progress. We are encouraged by the steps. We're encouraged what we're seeing all across Tennessee. I'm most encouraged by the fact that Tennesseans are owning this, that they are responsibly changing behavior that they are, in fact, doing what it's going to take to slow the spread of this disease so that we can get through this with the least impacts. And I'll add one other thing. Not only are people's lives at stake here and their health at stake, but their livelihoods are at stake as well. As most of you have heard, we have record numbers of Tennesseans filing for unemployment right now. We are addressing that from the state to the degree that we can, but it's going to take, again, the cooperation and working together as a community to address the great challenges that face our state before us. I am encouraged. I am hopeful. I know what's being done on the ground. I know what's being done right here in Shelby County. Shelby Countyans should be hopeful, and all of West Tennessee should know, as should all of Tennessee, that the folks on the ground, from brave healthcare workers to community leaders to nonprofits to the private sector, folks on the ground are taking this seriously, and they're combining and working together to make sure that Tennesseans' lives are protected and that their livelihoods are maintained to the degree that we can. I want to ask Dr. Piercy to come up to make a few comments. Dr. Piercy is the Commissioner of the Department of Health for the state of Tennessee. She serves as an important component of the Unified Command Team, and she will make a few comments, followed by Major General Holmes, who heads up our Department of Military, because as you know, we have deployed a number of our military staff here in Tennessee to help with assessment and remote assessment sites across the state. So, Dr. Piercy.
Thank you, Governor. Thank you, members of the media and members of the public. I do have the latest update on today's figures. We have 1,203 cases, 103 hospitalizations, and now 6 deaths. Again, we continue to see the trend in our younger population, specifically those under age 40. And even though we've been able to test over 16,000 Tennesseans, we continue to see this very disturbing trend of younger folks getting infected. And I'll repeat what I've said many times. Even though you might think that I'll get through this and it won't affect me as badly, it can affect you, and it certainly will affect others. So please do your part and stay apart. Specifically here in West Tennessee, of those 1,203 cases, 201 are confirmed in Shelby County and 30 are in rural West Tennessee. As the governor mentioned, there are testing opportunities growing by the day, and we encourage all Tennesseans, and specifically those in the Memphis metro area, to pursue those. The Tiger Lane site went up today, and Christ Community has been testing in their multiple sites for several days now. Also, you can call your provider or your local health system to look for resources. Once again, do your part, stay apart.
Thank you, Dr. Piercy. Major General Holmes, if you would come up and give an update on the National Guard and the role that they're playing in the state.
Yes, sir. So last week we started tracking the trends, the upward trends of possible needs. And under the governor's direction, we started alerting approximately 50. We went from 50 to 150, and we arrived at 250. 250 were mobilized this week, and there's 150 that are currently deployed throughout the state in 6 counties here in West Tennessee. We chose that number because we've got to stay ahead of the wave. We cannot afford to wait until the need arises. There's too many needs that are continuing to pop up, and when you don't really know where that need is going to arise, you have to go in with a very large reserve force, and we're doing just that. So we have another 100 that's mobilized in Smyrna. We are leaning heavily on our medical professions. That's combat medics, nurses, nurse practitioners, all of the medical branch, including portions of the 164th Air Wing here in Memphis. That's going to be our heavy forward force. They're also going to be very flexible, so they're in small, agile teams of 3 and 4 man many groups, and they have constant communications, and that gives us the ability to put forces on the ground and then maneuver them as needed based on the need. We also have a heavy contingent of logisticians. So our readiness centers are now collection points for collecting PPE and various other donations, and from that we'll create hubs of centers working with TEMA and the distribution points to push those out to all counties as their need arises. I want to thank the employers. So we are not mandating that we pull any critical job or anything. We're not stripping employers, healthcare centers and things like that of critical needed staff. We're very cognizant of that. We know that some of those medical providers are needed in the civilian sector, so we're not at all doing that. But I want to thank the employers, because the employers they're making a big sacrifice because we're pulling their talent away from their businesses, and we appreciate so much. Our employer and our service member partnership is so much important for us, and I just want to thank them. We can't thank them enough. They're great Americans for doing that, for supporting their guardsmen that are supporting these communities. Thank you.
Thank you. And if there are questions for either Dr. Piercy or General Holmes when we open this up for questions, please feel free to do that. I will answer your questions, but before I do, I want to just remind folks and encourage folks all across this state that there is a serious effort to protect the lives of Tennesseans and the health of Tennesseans from one end of this state to the other. This is a very serious threat that we face as a community. We certainly have the capacity to rise up like Tennesseans do to address it in a way that only we can, but it will take the efforts of every single one of us to do it. And be encouraged. We are doing some things very forwardly in our state, leading and moving forward in Tennessee. We're testing more per capita than many states in the country. We have encouraging news regarding our ability to access personal protective equipment. We have strategies in place that we believe will allow us to mitigate the damages to the greatest degree possible regarding the lives of Tennesseans and the livelihood of Tennesseans. So once again, do your part, stay apart. Together we can overcome this. Be happy to take your questions.
Governor, in terms of the per capita testing, how important is it for not only the team that you're working with and local officials, but the public to know the number of people being tested, positivity rates, all of that?
So the question was, how important is it that the public know how many people are being tested and what the positivity rate is? There's a lot of evidence that the cities in other countries and the countries themselves that had the greatest level of testing during this pandemic, those countries had the best outcomes with regard to flattening their curve. So testing is incredibly important, and that's why we encourage those who after assessment are able to get tests, that they avail themselves for assessment. The public needs to know. We need them to avail themselves. If they have contact with someone or if they have symptoms, then they need to go be assessed to see if they can test. Because if we don't know who has the virus, then we can't contain the virus to the degree that we would like to. Understanding the numbers of testing will allow us to understand the capacity with which we're reaching Tennesseans and having them present themselves available for testing. So it's all important data, but the most important thing is, and it's a challenge, having the resources. Testing has ramped up slowly in a lot of places, but we feel very good about our capacity and the increasing capacity that we have in the days ahead to test. It's a really important tool in attacking this virus.
That age group 40 and under, we've been hearing all week about how even though they may not be at risk, they may get the virus, but they may get pain, their blood sometimes inhibited to health. Just kind of stress that again about the importance of them taking this.
So her question was about the fact that 40 and under tend to be in this state the largest percentage of those who test positive, and part of the reasons for that and what problem that presents. So it's true, young people tend to have less negative impacts as a result of this virus. The most vulnerable population are the elderly. And sometimes that can tend to create a mindset among the younger component of our population that this doesn't matter that much to them, because if they get sick, they're probably not going to have anything but mild to moderate symptoms. There's an incredibly dangerous mindset. There's an incredibly dangerous threat to that mindset. And that is that those that are young, those that do test positive, those that do acquire this virus, they spread it to folks in the community many times long before they know they have the virus. And the vulnerable will be infected as a result of the vast number of people that have this virus. So what that means is, young people, not only are you potentially impacting your own health, but by disregarding this as being terrifically serious for you, you're actually putting the lives of Tennesseans at risk. 6 Tennesseans have already lost their lives as a result of this virus, and we suspect there will be many, many more. So please, every component of our society needs to take this serious and needs to understand that they have a part in flattening this curve. They have a part in saving the lives of Tennesseans. They have a part in mitigating the economic catastrophe that lies when people lose their jobs. Every person has a part. That's why our admonition to folks is do your part and stay apart.
Governor, you mentioned the unemployment claims that have been filed. Have you had a chance to maybe assess or take a closer look at the $275 payment that Tennessee provides to people who are on unemployment? Have you kind of taken a closer look at that at all?
So the question is about unemployment and the amount of unemployment benefit that is paid out to those in our state who file for unemployment. Let me just say this. 2 weeks ago, we had about 2,500 people file new claims for unemployment. Last week, we had about 37,000 new claims filed for unemployment. I spoke to business owners in Shelby County just a couple of days ago. I spoke to to folks who are in the entertainment and in the restaurant and in the hotel business, tourism industry. The losses of employment are staggering in this county and all across the state. So we're very concerned about the economic impacts of this as well, which is what causes us to be so thoughtful about decisions that we make regarding, well, any decision that we make that might impact businesses and jobs. You asked about the amount of unemployment insurance. What we do know is that Congress passed a bill today that will provide between $2 and $3 billion of aid to the state of Tennessee. Part of that aid will come in bolstering the unemployment benefit to every unemployed Tennessean. Those numbers are not clear, but the indication is there will be a significant increase in the unemployment benefit available to folks who lose their jobs or have a loss of income as a result of COVID-19. We'll know those numbers for sure before long, but it will be significant.
Governor, I know that some have been critical of the state's response, saying that we should have issued a stay-at-home order, a directive from your office a number of days ago, instead of asking people to stay home or putting that decision to local communities. What do you say to that? And was the state's response progressive enough? Is that order coming, or are we already at that?
You know, so the question is about stay-at-home orders, when they're appropriate. Specifically, you talked about a statewide stay-at-home order. You know, these are the decisions that require real discernment, and because we know that for every business that closes, jobs are lost and livelihoods are livelihoods are powerfully impacted. And in fact, there's a great degree of data that shows that healthcare is impacted in a negative way when people lose their jobs. There's a reason why the majority of states do not have statewide stay-at-home orders, but what they're trying to do, like we're doing in Tennessee, is have the right approach, the right decisions at the right time for the right place. So here's the reality in Tennessee. We are to a great degree shut down as a state. Every major population center has a stay-at-home order. The most populous counties in our state are all covered by stay-at-home orders. Every restaurant, dining room in the state, every bar in Tennessee, every school in Tennessee. I send troopers out to communities to assess the movement of people and to see what it's like, particularly in some of the counties that don't have a mandated stay-at-home order, but that traditionally have groups of folks like Gatlinburg. I sent troopers to Gatlinburg yesterday just to walk the streets and give me a firsthand view of what's happening out there. Tennesseans have shut down. This state is largely closed down, except for the number of folks that are moving around for the appropriate reasons. Now, that's not true of every Tennessean, and that's the reason we implore people daily. Do your part. This matters. People stay home. Don't gather. Stop doing the things that you don't have to do for a short period of time. But these decisions require discernment, and we have worked very hard to stop the movement of Tennesseans in this state by implementing a multitude, and I commend the leaders in this community who have taken the steps necessary to provide for the safety of Tennesseans. We're doing a lot. We're doing a lot in this state, and we're encouraged by the outcomes already.
Governor, is there any number that would change your viewpoint in implementing stringent measures? When you're thinking about whether or not to implement something strong, is there any case number in mind? Do you have any kind of maybe worst case scenario where you may do something a little more stringent?
It's different. It's difficult because there's very little evidence, and that's the reason that most states have some combination like we have, where they try to pick the uniqueness of their own state, and we are very unique. Tennessee's not like any other state. There are some that are similar, and I talk to those governors almost daily, governors from across the state, to assess best practices. Nothing's off the table. Things change daily. 3 weeks ago, we had no idea the impact that it could bring. 3 weeks from now, we do not know what that will look like. But I will say that there is the number one focus in the decision making that I have, that we have, is that the lives of Tennesseans be protected, and with the realization that livelihoods of Tennesseans are being profoundly negatively impacted as this virus spreads across our state. Yes.
Governor, we recently had a Kroger warehouse worker test positive, and that really slowed things down for that particular warehouse. Do you have any concerns about the food supply chain as more essential workers like that potentially become infected?
The question is around the food supply chain, and there was an affected worker at a food distribution company, and so I have met with the head of the Grocers Association and have talked to them subsequently a couple of times to ask specifically about the food supply chain in our state. And the head of the Grocers Association has indicated that our food supply chain is stable, it's secure, it is interrupted when people do panic buying. And we need to remember that when people go out and hoard or panic buy, then it disrupts that stable, secure food chain. So to the degree that we can encourage folks and actually prevent them from doing such, we are doing that, and we want to do that. But we believe that our food supply chain is stable and secure.
Let's move to a final question. First off, you mentioned that you're in contact every day with a few other governors that are states that are still being prematurely. And then secondly, we've heard from providers here that they're not required to report all tests in the world, because all tests are positive. So should people administer these tests be reporting all tests so they have an idea of the liver, or what's your message? It's not that they're not required to.
That's right. I'll actually let Dr. Piercy address the second question. I'll I'll reference it, and then I'll let her confirm. Your first question was, what governors do I talk to and who? So we have a governor's call every week with the National Governors Association. That call is open to every governor in the country, and most governors join on that call. I'm a Republican governor, and we have a Republican Governors Association. We have a call with that Republican Governors Association 2 times a week, and the president and the vice president, generally the vice president, has a call with all governors every week. And then I have, over the last year and a half, have come to have acquaintances with governors from around the country. And I will individually call many of those governors. I've talked to the governor from South Dakota, the governor from Oklahoma, the governor from Massachusetts, the governor from Georgia, and any number of governors. So, governors have really difficult choices to make in the midst of crisis like this. And best practices is a very good tool. And it's one of the reasons that I try to communicate across the country with governors from all across the country that are dealing with different circumstances than ours and that are ahead of us by 2 or 3 weeks. Some are behind us by 2 or 3 weeks, but that communication has been very, very helpful as I try to discern the right decisions for Tennessee. And your second question was around requirements for negative tests to be reported. That requirement is now in place. So for several weeks, the first couple of weeks, we were only getting positive tests and not negative, but we have begun to require all of our testing sites to give negative tests because that allows us to know the total number of tests, and total number of tests allows us to know how effective we are at getting our population tested. And I'm a strong believer that to the degree that we can aggressively test in Tennessee, we can more effectively flatten the curve. Do you have is there anything to add to that, Dr. Pearson? Okay.
Final question to Adrian Zanes.
Great.
Yeah, so Putnam County and Davidson County are dealing with tornado recovery as now coronavirus approaches, or has been there, for example, in Davidson County. Can you discuss that unique situation that they're in, and what kind of resilience, what kind of unity is required from people in that situation to kind of get through it?
So the question is about referencing the fact that Putnam County and Davidson County, and to a lesser extent, but to a significant extent, Wilson County, White County, Benton County, are experiencing the after effects of a devastating tornado in combination with this coronavirus sweeping through their counties. It's a significant double hit on those counties that are the hardest hit. When you consider Putnam County, just 3 weeks ago, 24 people were killed in that county, or 18 people were killed in that county, and most of them in the same neighborhood by the effects of a significant tornado that went through there. Though that community is still reeling from that, and now they have community spread of coronavirus going through that community as well. What I will say is that we have not stopped as a state in our efforts. First of all, let me just say the overwhelming response of Tennesseans in the aftermath of those tornadoes was something that made me proud as a governor, and something that the country looked to with inspiration because of the way Tennesseans turned out by the tens of thousands to serve their neighbors in need, in the same way that we're going to do so with this COVID-19 virus. But after the neighbors turned out, so did our state efforts through TEMA and the federal efforts from FEMA. And let me just say, the federal government was incredibly responsive to our victims of our tornadoes, from the fact that the president called me the day after the tornado, that first morning, to FEMA director coming to my office the next day from Washington to begin the process of providing relief. That relief has not stopped. We are continuing to provide, we have FEMA in the communities that are affected. TEMA is in those communities. Fortunately, the vast majority of outreach from FEMA to TEMA to those to the victims occurred in the first few days before the COVID virus became as prevalent. But we've tried to remind the folks that are unfortunately victims of both crises in their communities that we haven't forgot them, and we won't forget them, not their neighbors, and especially not the support available from FEMA and TEMA. And our director, Patrick Sheehan of TEMA, is with me here today. It plays such an important role in those efforts, and we're pleased that those efforts have continued.
All right, that's all the time that we have today.
Thank you
for your
all.
questions and for joining us.
Thank you all very much.
Symptoms that I had had for almost 20 years. Let me explain this to you.